So, Dr. Sandler,
Sir.
you can cure depression and anxiety.
Yeah.
And when you're
Probably
talking
not a couple of I just gave a little talk about what we're doing. I'm also a counselor.
Welcome back to Psychobabble. We've got Dr. Sandler back again,
And Dr. Kishore.
and Dr. Kishore, and we're going to talk more about psychotherapy and your book, Tea with Freud. There are a lot of things I think that we can explain to our viewers and what you talk, because there were so many complicated things in that, right?
Mm.
And one of the things that I thought that today might be a good thing to talk about is you mentioned Anna O in that chapter.
Yeah,
the
the
first
famous
chapter.
case.
Yes, so a lot of people know a lot about it. Some people might not even have heard that name.
Yeah.
So why don't you just explain it a little bit so that
Yes. In the first chapter, with my first imaginary discussion with Freud, he tells me about the history of psychoanalysis and who influenced him. Everybody thinks that it all started with Freud. That's actually not true. It started with a man named Joseph Breuer, who was an older man who was an internist, and he was a friend and mentor to young Sigmund Freud, who was completely unknown. And Breuer was an internist who saw a young lady come into his office with a cough one day. And he listened to her, and he got a history, he listened to her lungs, and he said he knew immediately there was nothing wrong with her medically, that it was what they would call a hysterical cough, or now we would call it a conversion disorder, a physical symptom with no real medical etiology. So he said, well, this is hysteria. So he began making house calls to check on her. For what reason, I don't know, reassure her, chat with her, but she had a lot to talk about, and she had a traumatic memory of her father dying, and she had memories of sitting by her father's deathbed and feeling very anxious and having visions when she was asleep or half asleep. It was very traumatic for her. And sometimes he would use hypnosis to calm her down. I don't exactly know how he was inducing hypnosis, but he began to make daily house calls. Imagine doing that. No more. Anyway, one day she said to him, Anna O, as he called her when he wrote it up, she said she had a phobia about drinking water. She had all kinds of strange symptoms. She could only speak in English, not her native German some days, all kinds of symptoms. She said, I can't drink water. Then he said, when did this first begin? So she says, well, I was feeling sick, and a friend came to visit me with her little dog, and we were chatting, but then her little dog jumped up on my bedside table and started to lap water out of my drinking glass. Anna was furious telling this story. What kind of a friend would allow this disgusting little dog to jump up on my table and drink water? She was so angry and vented all this anger about her friend. And when she was done telling the story, she was a little parched from talking and reached over and put down an 8-ounce glass of water. Breuer turns to her and says, I thought you had a phobia about drinking water. And she says, I did.
It's gone.
It's gone. So Breuer goes home. He's fascinated and he thinks, what happened here? I identified a symptom. I traced it back to a disturbing event in her life, the dog lapping water.
Yeah.
She vented all this emotion and she's cured. So he says, as he wrote this case up later, he went back the next day, said, tell me another symptom. When did it first begin? She vents more emotion and it's gone. So he tells this story to his young friend, the unknown Sigmund Freud, and Freud says, that's really interesting. I got to go back to my office and do that. So it didn't start with Freud. It started with Joseph Breuer. And of course, what he discovered was a couple of critical things. That emotion is really important. Now we have a ton of research saying that if you get in touch with some feelings in therapy, the outcomes tend to be better. And two, patients coming in often have traumatic memories. I wouldn't call this a huge trauma that a dog lapped water out of her glass.
Well, probably for her.
For her, yeah. And of course, many of our patients have far worse memories.
Yeah.
And so they said in there when they collaborated on a book some years later, they made a statement, hysterics suffer mainly from reminiscences. People with these hysterical symptoms, these physical symptoms without a medical explanation, they have bad memories. Often turns out to be true.
Yeah, yeah.
That was the beginning of psychoanalysis.
Yeah. But we don't see hysterics anymore.
Well, we do see conversion disorders.
How much? Well, coming from India, that used to be my bread and butter. We used to see every day, at least 2 or 3 cases,
Every day, 2 or 3?
Yeah, yeah.
Wow.
But since I came to the U.S. 20 years back, I might have seen 1 or 2, 3 cases in those 20 years.
Is that right?
Yeah.
Wow, the cultural difference is huge then.
Yeah, yeah. Mm-hmm.
But on the pediatrics floor at Albany Med, several times a year, at least several times a year, we would have a kid or a teenager, often a teenager, come in and say, I can't walk.
Yeah.
And more often than that, somebody who comes in with a seizure, which is not based on brain activity, a so-called pseudo-seizure. Not that they're faking, but it's a conversion disorder. And I'm told by the adult neurologists, they see a lot of that still. So maybe not all the symptoms that Freud and Breuer saw, but still we do see a lot of people with these conversion symptoms.
So Freud and Breuer, they considered the traumatic memories and the object associated with as an explanation for the hysterics, conversion disorder, as we call them now. But you think that it is more than conversion disorder? No, that you're probably using it for most of your cases, right?
This theory?
Yeah.
Yeah.
So it doesn't apply only to conversion disorder.
Right. They talked about hysteria, hysterical conversion. But I would say most people coming in to see me for therapy, not for ADHD meds, but for therapy, have had difficulties in their earliest relationships as kids. They've got troubling memories, and they've bottled up some emotion.
Sure.
All of which is what they said in their first book in 1893, their first paper, 1893, Freud and Breuer. That's a long time ago for them to know that.
Yeah. So what is conversion? What is conversion? Yeah.
Well, Freud said that the patient has unconsciously converted a psychological problem to a physical problem. The most obvious example I saw was a teenager at Albany Med who had a seizure, supposedly, but the EEG was normal, and the neurology folks say this is not neurological, this is psychological. His father had been sent to prison for beating up his mother, and the parole date was coming. So I thought it was a pretty obvious stressor. Sometimes you can't find the stressor that quickly. Dad was getting out of prison in a few days. The kid has a seizure, gets into the hospital, and he looked quite happy to be there, by the way. He was in a safe place, and his mother was sitting in the hospital with him, where she could be safe from his father. There was, I think, an obvious case where there's a stressor triggering the
Yeah, but from Freud's time now, we see less of that, right?
Of the conversion.
Why do you think that has happened?
I suppose there's something in culture that encourages certain symptoms and discourages others. I remember Bessel van der Kolk, the trauma therapist in Boston, showing a tape of men with shell shock, PTSD, and they were shaking and they could barely walk, and they had 2 guys helping them. They were all wobbly and shaky, and he said, you don't see the symptom picture anymore, but we certainly see PTSD with the guys coming back from Afghanistan.
Right. Yeah.
So there seems to be a cultural milieu that pushes us in one direction or another.
Yeah.
And I don't fully understand how that works.
I have a hypothesis, and I think that now that people are, becoming more communicative about their emotional state, so it is okay to go ahead and say to someone that I am feeling hurt, or I'm feeling sad, or I'm feeling angry, and I don't agree, I'm being traumatized. There was a time when probably that was not, that was not encouraged, and people wouldn't do that. So the only way to do it was through a physical symptom that you would get attention,
Right. And that fits the research that says conversion disorders are more common in people with less education, and they're less psychologically sophisticated.
Right.
So they might be expressing their psychological distress in a physical sense. I can't walk.
Yes.
Whereas somebody else might come into our office and say, I'm so distressed I can barely go to work. I do go, but I feel weak because my wife is threatening to leave me.
Yeah.
I think you're quite right.
And there are a lot of people who have got very good education, but they're not psychologically sophisticated too. So what is the difference between education and what is psychological sophistication? What do you mean by that?
How much time do we have? I don't have a short answer, but my daughter Eve, who just graduated from social work school, is very interested in emotional education of kids, of emotional intelligence. The idea that we could teach children, as part of their education, something about naming their feelings and responding appropriately to the feelings of other kids. This has been around for decades, this idea. And I think that would be wonderful, because I've seen people in the office who are completely brilliant in their fields, but they don't really think psychologically. When I ask them about their emotions, they're confused by the questions.
Yes,
right? The most basic question about how do you feel, and they give me an answer about how they think.
Right, So Anna O has made a big contribution to mankind, I guess, right? To open up these kind of dialogues and a whole field of science.
She did. She called the technique chimney sweeping.
Chimney sweeping.
When Dr. Breuer would come to her house and talk to her and help her vent, she called it chimney sweeping. Although we know now that afterwards Anna O did not do well emotionally. She wound up in a psychiatric hospital at some point. So Freud and Breuer claimed this as their first big success. It was not, but still a useful case, an instructive case.
Yeah. And maybe there's some movies made on Anna O case. I'm not sure. I'm just curious. It's such an important figure. Why don't more people know about her?
It's an important piece of history.
Yes, it is.
The history of talk therapy starts right there with Anna O.
Yes. And not only talk therapy, about this whole thing about psychological sophistication. Now it is becoming okay to talk about feelings, that there is something about, there is a possibility to talk about feelings and discuss them. So, good contributions from Anna O. We can stop it today here.
Very good.
And meet again next week.
Sounds great. Thanks for listening.
Yep.
I just gave